Good morning. My name is Donna Emma. I am one of the co-chairs of the Mass General Hospital Leadership Council for Psychiatry. I want to welcome you and thank you for taking time today to listen to this special presentation discussing the remarkable research being done by Dr. Daphne Holt. I'm a great admirer of Dr. Holt's resiliency prevention program for young adults. Navigating the college years is a challenging time for young people and made ever more difficult during a pandemic. We are grateful that Dr. Holt has agreed to speak with us today and explain how young people can effectively develop resiliency by utilizing the coping skills in her program to become healthy and productive adults. Our webinar format is listen-only mode. While Doctors Fava and Holt are speaking, please submit your questions via the chat function on your screen. Dr. Fava will moderate a Q&A after he and Dr. Holt complete their presentations. It is now my great pleasure to introduce Dr. Maurizio Fava, Chief of Psychiatry at Mass General Hospital. Dr. Fava will speak about his bold initiatives for the department before introducing Dr. Holt's resiliency research. Dr. Fava?
Thank you so much, Donna. Good morning to everyone. On behalf of all of us in the Department of Psychiatry, I want to welcome you to Dr. Daphne Holt's presentation, Becoming an Adult in a Pandemic, Tools for Resilience and Prevention of Mental Illness. This is a topic that speaks very much to my vision for the department, what I call bold approaches for the future. We need bold approaches to remove barriers to treatment, to end disparities in care, and to increase access to services for people in need through the groundbreaking research, knowledge, and expertise that we have at the Mass General Department of Psychiatry. I'm so pleased to introduce Daphne and to tell you why we're so proud of her and why her work is so important for all of us. Daphne is the founder of a pioneering program focused on ways to prevent psychiatric illness, the Resilience and Prevention Program. A faculty member in our department since 2004, Daphne conducts groundbreaking research on the neurobiological basis of serious mental illnesses. Her work has been recognized by the entire hospital when she received the prestigious Research Scholar Award from the MGH Research Institute. I remember very well the first time that Daphne approached me about her interest in investigating preventative interventions in young adults. A critical time when psychiatric illnesses often develop. We brainstormed together and invited her to collaborate on a study I had been running in the depression program for many years, which screened and treated college students for depression. Daphne had added an early detection and neuroimaging component to the project, making it extraordinarily cutting edge and exciting. Several years later, George Hendren, who I believe is here today, and his colleagues at the Sidney Bear Foundation awarded Daphne the initial funding to launch the Resilience and Prevention Program. And we're very grateful to George and the Sidney Bear Foundation for doing that. The goal of the program is to protect young people who are at risk for developing psychiatric illnesses by increasing their ability to manage stress, their resilience. The program is highly innovative. It's focused on prevention. It's on prevention, and it applies the latest advances in cognitive neuroscience to evidence-based practices. Also, it does not target only one illness. It seeks to build resilience in young people to protect them from developing a range of illnesses that may affect them. And all these aspects, linking neuroscience and having a very comprehensive approach, are extraordinarily novel in the field. Daphne and her team have developed resilience building preventive programs for a number of populations. And today she'll telling us about the program for college students. Even before COVID-19, there has been a crisis in college mental health. Over the past several decades, there's been worsening depression, anxiety, and suicidal thoughts in our college students, which has overwhelmed the limited resources of college counseling centers. Being in college or even applying to college can be stressful, made worse by the lack of sleep, lack of physical activity, poor nutrition, relationship problems. The need to build resilience among college students is absolutely great. And the pandemic has heightened everyone's stress and anxiety, but especially the stress and anxiety of young adults. COVID-19 has made life more difficult for college students. And college students are now experiencing even higher levels of symptoms of depression and other symptoms. And their academic performance has worsened as a result of COVID-19. College students face another uncertain year of dislocation, disconnection from their typical supports. Their interactions are severely limited, and they must deal with drastic curtailment of their social life outside of the classroom, which is so important for their development. Many of us here today have college young adults in our lives, and we're worried about them. We understand your concern, and we're very grateful that Daphne is here to share her knowledge and expertise. Before we begin, I just want to remind you that I'll be moderating the Q&A session after Daphne's presentation. I'm encouraging you to ask all the questions you want, which you can submit at any time by clicking on the chat button at the bottom of your screen. And now, please welcome Dr. Daphne Holt.
Thank you so much, Donna and Maurizio, and thank you, all of you, for coming today. I really appreciate it so much that you took the time to hear more about what we're doing. So, you know, you heard a little bit from Maurizio about how I started to become interested in this kind of work with college students and resilience and prevention. I remember working with Maurizio on his college depression screening program and meeting so many young people, so many students who were really struggling so much with a whole variety of challenges and sometimes initial symptoms of mental illness. But yet so many of them were really not so interested in seeking help. You know, they were not interested in being referred to a psychiatrist or a therapist, despite some of their struggles. And this, you know, really presents a big challenge. And so I have really been inspired to think about how we can reach some of these kids in a better way than we are at the moment. So I want to first tell you about a woman who I met. I think this will help explain a little bit better, you know, what type of student we're trying to help with this program. I want to tell you about a woman I met, and I'm going to call her Andrea, even though Andrea is not her actual name. And this picture that I have here is not her actual picture, but her story is real. Andrea, you know, was when I met her, I think it was 2 weeks into her freshman year. And she was someone who had been a great athlete, a really good student in high school, had many friends. But she also was, you know, kind of a vulnerable person in a lot of ways. She'd had a history of difficult romantic relationships where she took some breakups kind of hard, and her self-esteem, her sense of self-worth was not very high. And then she had this really terrible thing happen to her, you know, maybe a week or so before I met her, where she was nearly sexually assaulted by an acquaintance, another student, someone who she thought was becoming her friend. And so this was really a big surprise. And she was really blaming herself a lot for putting her in this situation. And she was obviously very distressed and fearful, not sleeping well, not eating well. And she was even having some sort of, passing thoughts about suicide, nothing that she said that she would act on. But, she said she basically felt like she wouldn't mind, or she'd even be glad if, for some reason her life would just end and she wouldn't have to deal with all this stuff. But, when I asked her if she'd be interested in a referral to see a therapist or just an evaluation, a brief one-time evaluation, she said, "You know what? No, I'm okay, and I'm too busy anyway. I've got so much going on." But when I did tell her about the program that I'm going to tell you more about today, the resilience training program that we're offering college students, she was interested in that. And I think part of what was appealing about it was that we really focus on enhancing resilience, enhancing people's ability to manage stress and handle difficult life crises. And the way that we talk about this is that we're essentially trying to augment people's existing psychological strengths. So we're not trying to get rid of anything. We're not necessarily, it's not a treatment program per se. It's more like the way that you would work out to be more healthy, or eat better to prevent developing physical illnesses. And the other thing I think that was appealing to her was that we ask all our participants to collaborate with us to try to make the program better. But as Maurizio mentioned, the situation for college students right now is just, even for the past decade, things have been getting worse in terms of all the measures that we have of mental health in college. But right now, things have gotten a lot worse due to the pandemic, as you may already know. So this plot here, this figure shows, is from a study that the CDC did at the end of June, where they collected information about mental health from a sample of US adults. And you can see here on this graph, they broke it up by age group. And the orange bars here are the college age adults. And then these lighter orange bars are older age groups. And you can see just by looking at this just for a second that the college age kids are the most affected in terms of their mental health by the pandemic. So a whopping 75% reported some mental health issues during June. And obviously things have gotten worse since then. And 25%, 1 in 4, reported seriously considering suicide in the past 30 days. So that is something like, it's more than double what we normally see. So these kids are really struggling. And this has been picked up by the media, of course. I'm sure you're aware of that. And the concern really is that what's happening right now with these young adults is really going to have lasting effects, lasting consequences for a while, for the rest of their lives potentially. So what can we do about this? Well, I first just kind of want to take a brief step back and talk about something that I think everyone is pretty well aware of, and that is the fact that prevention, strategies to prevent major illnesses has been one of the greatest success stories in modern medicine. So things like prenatal vitamins, childhood vaccinations, smoking cessation programs, all the different kinds of things that we now do to detect cancer or the signs of cancer early. All of these have incredibly, increased our lifespans and reduced the burden of disease in our society over the past 60 years. And even now, obviously, we know that simple behaviors like hand washing, mask wearing, can reduce the risk for COVID-19 infection dramatically. And we're all really anxiously awaiting the development of a vaccine that will finally let us possibly return to our lives the way they were before, we hope. So what about some kind of vaccine for mental illness? why not? Why hasn't this happened? And in fact, there's a lot of research that's been done in recent years that show that this is possible, that we can do this. So there have been studies showing that we can prevent depression, we can prevent anxiety disorders, and we can even potentially prevent psychotic illnesses. But for some reason, these initial studies have not led to large public health efforts aimed at prevention at a larger scale. For a number of reasons. So we have a lot of work to do still. So how do we do this? When should we intervene? When should prevention happen? Well, so this is a schematic of, somebody symptoms over time. Let's say Andrea, while she was in high school, maybe she had some little times of feeling more anxious or a little bit more depressed, depending on what was going on in her mood. But these fluctuations kind of came and went and didn't necessarily affect her functioning, or not necessarily all that debilitating. So, many people can go through their whole lives, just with this, what we call kind of subclinical or subthreshold kinds of symptoms. But sometimes, especially in the context of a major life event, a major life stressor, these kinds of mild symptoms can turn into something more serious, something that is more concerning, and what we might call an illness, something that is going to be persistent and debilitating unless it receives treatment. So say for Andrea, perhaps this terrible thing that she experienced during the first few weeks of school might trigger the onset of some kind of illness. So the idea of, using techniques that increase resilience to perhaps prevent the onset of these illnesses is that, perhaps during this period when people have some risk factors, say, for developing illnesses, but are not experiencing debilitating symptoms, that we can increase people's ability to handle stress, that we can make it perhaps less likely that if they encounter a stressful event that they'll develop an illness, and perhaps there might be a different outcome where they're more protected. Or if they developed an illness, perhaps that illness would be less severe. And so there are many different kind of periods when we could perhaps do this sort of preventative work. Our program focuses on this kind of mid-level of risk, where people have some symptoms, so they have some risk factors, but they're not too concerned or debilitated. And some studies have shown that this is really the ideal time to intervene. But of course, it would be great, it would be ideal actually, if we had different kinds of interventions for all of these different levels of risk. So let me tell you about our program. So the way that the program that we're running in college students works is that we screen to identify students who are at risk because of some patterns of thought that they're having, or some mild distress that they're experiencing. And we're doing this right now at 4 different colleges in the Boston area. And then people who are eligible are invited to do this 4-week course or workshop that we call resilience training. And this course includes exercises, discussions, home practice, didactic information. I'll tell you a little bit more about it in a second. And then we track students over time, see how they're doing, following up every 6 months, see how they're doing academically and in terms of their social functioning and their symptoms. So in the program, we focus on 3 evidence-based tools that are known to increase resilience: mindfulness, which you've probably heard of, and also self-compassion and mentalization. So mindfulness, as you may know, is essentially the capacity or the ability to really pay close attention to the experiences of the present, meaning paying attention to your bodily sensations, to all the information that your 5 senses are bringing you about the external world, the feelings that you're having, the passing thoughts that are coming through your brain, but everything that is just happening right now. And that we pay attention to these things without avoiding these experiences or judging them. So numerous studies have shown that mindfulness practice increases resilience, decreases a range of psychiatric symptoms, and actually increases brain health. So this is just an image of the human hippocampus, a very high resolution image, just to remind me to tell you that this is one part of the brain that we know is really important for emotional health. It's important for memory and emotional function. And several studies have shown that mindfulness improves the functioning of the hippocampus. And actually, there have been some really interesting recent studies that have shown that mindfulness seems to combat the effects of aging on the brain. So self-compassion is another tool that we focus on in our program. And self-compassion practice essentially involves learning to treat ourselves with kindness during difficult times, as if in the same way that we would treat a friend who was in the same situation. So say at a time when you feel like you've done something wrong, when you're feel that you failed or you're blaming yourself in some way, is there a way to learn how to treat oneself how you would treat someone else who you care about, who's in that same situation? I think this is a tool that is particularly valuable for young people who are immersed in social media, where there's so much comparing themselves to other people and shame about, not measuring up in some way. And so this tool has been very popular in our program. And the idea is that greater self-compassion can then lead to greater compassion for others, and the combination of compassion for yourself and for others actually then leads to greater social connectedness, which is then very protective in terms of increasing resilience and making it less likely that you develop a mental illness of some kind. And then the last tool I'll mention that we emphasize or teach in the program is called mentalization, which is the ability to understand or think flexibly about the mental states and intentions of others. So you can think about it like, it's a way of thinking about lots of different possibilities for why a certain person behaved a certain way. And this is a very popular tool in our program as well. And I've included this image of that's taken from this very well-known test of mentalization called the Mind in the Eyes test. So in this test, you're only allowed to see the eyes of the person. And you need to figure out what emotion they're experiencing. So, feel free to give it a shot right now. And if you said playful, you would be correct. So you can see that this is a skill that, is not always easy, but it's something that you can actually learn. So just to return to Andrea for a second. So Andrea did enroll in our program, and she really, she was a very enthusiastic participant. She began to learn how to use all the tools I just mentioned, which helped reduce the amount of distress she was experiencing. And she was able to actually mostly stop blaming herself for this horrible, near assault experience that she had happen. And she also played a really nice collaborative role, provided us with feedback on what exercises and examples had been most effective for her, and what she was going to be using in the future. And then, we've been in touch with her, obviously. And so recently, during the COVID-19 pandemic, she is still using these tools to handle some of the stress and conflicts that have come up while she's been living at home with her family. And it's really helped her stay focused on attending her online classes, doing her work, and keeping in touch with her friends, which is really important for maintaining her resilience. So now I'm just going to play a little clip of some of the participants talking about the program. And I just want to just warn you, just apologize that syncing of this clip over Zoom, we just realized is not perfect, but hopefully you will still hear the message of what the students are saying.
After completing the program, I have consistently used the various exercises that were taught, such as the mindfulness exercises, in my everyday life.
I just think that this course is just really important for students, just to kind of keep themselves from feeling like everything is attacking them, and being able to have ways to wind down and deal with it, and just being able to understand themselves to a higher degree than before.
I think courses like this are very important, especially if you're coming in as a freshman like I did, because you don't really know anybody, or you might not know what to expect from college. It was really, really helpful for me to see my problems in a new light, and also to be able to discuss them in a group situation where other people who are in the same situation as me for a bunch of different reasons, and like understand me for a bunch of other different reasons, we get to work through those problems together as a group, and I get to have that fresh perspective. That was really amazing for me. Especially during this year where students are even more isolated due to the pandemic, it's important for this course to continue teaching students how to navigate these emotions and stressors. I have benefited so much from this course, and I know others will too.
So I'm just going to very briefly now tell you a little bit about the research that we've been doing, because of course we also need to, measure what we're doing and make sure that what we think is happening, is really happening. And so we've conducted a couple of studies, and we've been really gratified to learn that, in fact, yes, our resilience training program does increase resilience and decrease symptoms. You can see this in this graph here. So this shows the resilience levels of people who participated in the program. So those increased after doing the program, while the people in the control group, so people who didn't participate, didn't experience that benefit. And the same for the symptoms. People who participated in resilience training had reductions in symptoms of depression and anxiety, while the people in the control group did not see that. And then these effects were actually still present 6 months later. And we also found that the people who participated in the resilience training program saw increases in their GPA 1 year later, while the people in the control group didn't have that improvement in their GPA. And then lastly, we're very interested in the effects of the resilience training on the brain. And so we've focused on using functional MRI to measure the functioning of this pathway in particular that we know is really important for the regulation of emotion, and we know that it's important for resilience, for this pathway to be working well. And amazingly, we did find that the connections between these two regions, this pathway, became stronger following resilience training, while the people in the control group didn't see this change. So that was really exciting for us to see. So I'm just going to close by telling you a little bit about what we're trying to do now and what some of our goals are. So one of our biggest goals right now is to try to make this program available to as many college students as possible. So we're doing this via Zoom. So now, because of the pandemic, we're delivering all of our resilience training via Zoom. The other thing that we're developing is a virtual reality version of the program. This program is called Reconnecting with Ourselves and Others in Virtual Meetings, or ROOM. And the reason that we've decided to use virtual reality, well, let me just first explain how it works. So everybody gets a headset mailed to them, and then they choose an avatar, and then everyone joins a virtual meeting room via this headset. So people can join the program wherever they are, in their living room, in their dorm room, and participate in this virtual resilience training program. And the idea is that it seems that via virtual reality, people feel much more physically present, much more like they're physically with other people. So there's a greater sense of connectedness with virtual reality. And the other great benefit of virtual reality is that people's who are concerned about their privacy, it's possible to join a virtual reality group without revealing who you are. You don't have to use your name, and you're joining as an avatar. So people are concerned about the effects of stigma on, you know, doing any sort of mental health program, you know, can have their privacy protected that way. So we're very excited about that. And then another goal is to develop a more tiered program where we develop specific tailored interventions for different levels and types of risk. And then lastly, one of our sort of ultimate long-term goals is to use some of the data that we're collecting about objective neuroscience-based markers so that we can predict with much greater precision who most needs a resilience-enhancing preventative intervention and which intervention is most appropriate for you know, which person. So I'm just going to close by showing you a little clip of a virtual reality environment. It's not the one that we're using for our intervention because that one is not quite ready yet, but for this, this clip gives you just a flavor for what the environment looks like, could look like, and what the virtual characters look like. So that's it. That's the end of my presentation. And so I'm really looking forward to questions and discussion, which I think is going to be moderated by, here, I'll just stop the share, moderated by Dr. Fava.
Well, thank you so much, Daphne. It was fantastic. And I have to say, I'm so excited about this virtual reality approach. It's incredible. So thank you. Please remember, you can use the chat function to ask questions, but we already have lots of questions. So we'll try to get to all of them if we can. First question, I think it's a great question. Colleges are focused on the physical health of students, but what needs to be done to address their mental health during the COVID-19 crisis? So, Daphne, before you answer, it's a great question because, you know, there are colleges, for example, here in Boston, Tufts and Brandeis, they're spending $500,000 in testing, COVID testing every week to make sure that their students are going to be okay, they don't develop COVID-19, et cetera, et cetera. So on the physical health, they're spending that much, okay? For COVID-19, at the end of the day, in that age range is not as lethal as suicide. In the United States, it's predicted that we'll go from 44,000 suicides each year to over 70,000 suicides in the United States because of COVID-19. So, and the age group that is most affected is the college age group. So, so I think that, in my opinion, what Daphne is doing is absolutely critical because we have a tremendous need, and the reality is that colleges cannot offer enough for the students. But Daphne, what do you think?
Well, yeah, I think you answered that beautifully, Maurizio. I could not agree with you more. You know, I think I've thought throughout the pandemic that the balance, you know, in terms of, you know, how people are making policy decisions in terms of thinking about physical health versus mental health we haven't quite gotten that right yet, you know, and I think that's going to become more and more clear that we need to pay much more attention to the mental health consequences of this pandemic. And you're right, you know, college counseling centers are fantastic, but they really are under-resourced, and they're really more, you know, focused on like a crisis, you know, management mode, you know, and so I think, hitting the pipeline earlier, sort of, obviously that's what I think, that intervening earlier is going to be ultimately what we need to do to protect people.
Thank you, Daphne. It's a great question. Another great question. What's the best way to reach and support kids who are introverted and hesitant to speak, share, even to a parent? Yeah, we know as parents, we often are the last ones to find out. So, how do we help the shy and hesitant kid? Because this is a program that is, in some ways could be really beneficial to those kids.
Yeah, so I think, one thing we have really tried hard to do is, not, as I think I mentioned before, not make this about mental health, not make this like you have to tell everyone all of what's going on with you internally. It's very skills oriented. It's like taking a course where you're learning a skill, the same way that you would learn how to use the the row machine at the gym or something, and so I think that is helpful, for introverted people. I think the other thing that's helpful is that the group, being with a group of peers, I think is incredibly beneficial, and something that we have underused in the world of psychiatry. I mean, there's some, group work, but it really is incredibly powerful to hear what other people are experiencing who are going through the same thing you are. And even if you say nothing in a group or you say very little, you're then getting a lot of benefit.
Two great questions, and they're kind of closed together. One is, how much does it cost to bring the resilience training program to college campuses? And two, from another listener, what is the cost of this program? Is it a train-the-trainer program? So they're connected, but I want to mention that this is why philanthropic support for Daphne's program is so critical, because if we want to scale up and make this more available, we're not going to get money from the federal government. And, the reality is that colleges who could invest in this, I remember years ago, I went to a college that had a string of suicides, and I approached the provost and I said, can we come in and do our screening? We do it at our colleges. And the provost said, no, please don't come in. You identify a lot of people who have needs, and we can't provide it. So don't come in and screen it, please. So what's your answer, Daphne?
Yes, no, that's a good question. I mean, I think, it's, we actually tried to calculate this, that it's something like $1,000 per student to deliver the clinical piece. Obviously, the research part of it can be expensive, the neuroscience that we're trying to do, but we do really feel like that's really important. So I think when we expand, in some cases we'll just deliver the clinical piece, but the research part is an important part for us to really take it to the next level in terms of, really being like the rest of medicine, where we use objective markers to figure out, who needs the intervention the most. So, and then the trainer idea is certainly something that we want to do, and that if we really scale up, we definitely have to do. We have not done that yet. So right now we have our own therapists delivering the intervention. But it wouldn't be that hard for us to transition to a more train-the-trainer model.
Another great question. Why is it important to link neuroscience to this clinical intervention?
Yeah, well, so really the idea is that, when you meet a young person who's having, a bad day or something, who is upset, who, maybe is a little bit suicidal or any of that, it's impossible for us to know exactly what's going on, because we have to rely entirely on what that person is saying to us, and then some people are saying, some kids will say nothing and they'll be very sick, or some kids will say a lot and they're just having a bad day. You know, the way that we in psychiatry are still 100% reliant on what a person says, even though we know that our illnesses affect people's judgment, in some ways is completely crazy, right? So we really need so badly to get up to the level of the rest of medicine. We need something that's more like a blood test, you know, and it could be used in combination with, you know, what the person describes their subjective experiences like, but we need something that's more objective. You know, otherwise these kinds of interventions can be very inefficient, you know, where we're treating people who maybe don't necessarily need treatment, and we're missing people, you know, who really need our help.
Thank you, Daphne. Another great question. What are some of the risk factors for developing a psychiatric disorder in the college students?
Yeah, well, that's a big question, which I could give a whole talk on. But, you know, I think the short answer is, you know, psychiatric illness risk factors are, you know, there's genetic risk factors, and then there are things that happen in your life, sort of environmental risk factors. And those things, you know, can be synergistic. But say for resilience, people think that your ability to be resilient is about 30 to 50% determined by your genes. So that gives a lot of room for, you know, change, that, you know, essentially that we can improve our resilience. But, you know, and then the thing that's really interesting in psychiatry, which is not necessarily true in other fields of medicine, is that there are a lot of shared risk factors across illnesses. And so, for example, having a very difficult childhood increases your risk for almost all psychiatric illnesses. And there are certain genes that increase your risk for all the major psychiatric illnesses. And so this is actually something that we can take advantage of when we design preventative interventions, because we don't need to say, oh, we're just trying to prevent bipolar disorder or depression or schizophrenia. We have these shared risk factors that we can target all at the same time.
Thank you, Daphne. You know, it's this is one of the things that you know, your transdiagnostic approach is so critical, because in some ways it eliminates the artificial barriers. And sometimes we say, you know, people think, well, I have this, or my son or my daughter has this, as if these are kind of well confined and delimited. There are, you know, conditions when in fact they, you know, there's a lot of kind of crosstalk, if you wish, between them. And so sometimes, you know, you have a parent with bipolar disorder and completely focused on bipolar, and then the kid really develops anxiety or depression. Not, you know, and you know, your work has clearly pointed out to the fact that it's a general risk. It's not just limited to a given diagnosis. So another question, a great question here is, let me pull it up here. Whoops, I gotta go up on the list of all the questions that we got. It was early on. Is there variability across young people to use the resilience tool? So some kids just take it in, and it's more challenging to others to really get under their belt. Does practice make a difference? Great question.
Yeah, that is a great question. Yeah, well, I think it's a really good point that there is certainly individual variability, or, you know, people are different in terms of what kind of skill speaks to them the most, you know, in terms of, you know, if they prefer to focus on mindfulness practice. Self-compassion, you know, is very beneficial to a lot of people, but a lot of people find it like very, no, they're not that comfortable with it. And mentalization is sometimes, you know, is not always easy to grasp. So I think of the way that we think about it is it's like a menu of tools, and we have more things that we talk about in this course that I didn't have time to mention, and that, people can choose what benefits them. And I think that's a really important point that we try to drive home in the course, is that everyone is different in terms of what makes them resilient. And we spend a lot of time thinking about that. Each person, has to focus on, what are the things in my life that have helped me handle stressful situations? Some people need to be with people. Some people really need alone time. Some people, need to exercise a lot. Some people prefer, entertainment and things. There are things in your life that can be very variable across people. And now I've forgotten the second part of the question. There was another part, wasn't there?
Does practice make it better?
Yeah, practice definitely makes it better. It's like any skill. It's like, learning to play tennis or something. It's like a muscle in your brain that needs to get bigger. I mean, when you think about mindfulness practice, probably everyone has tried that a little bit. It seems really simple, right? It seems like, duh, how could you not do this, be able to do this? But it's not natural. Our brain likes to ruminate about the past and think about the future. We don't like to just be in the present moment. But it's been shown that people can practice it and learn it. And then the parts of the brain that are involved in that process actually get bigger when you practice it more.
Thank you, Daphne. Another great question. I would like to hear more about mentalization, aside from the mind plus eyes test. How do you teach this skill?
Yeah. Mentalization, as I said, is one of our more popular skills. So one exercise that we have in the program is that somebody tells a story of something that they actually had happened to them. Somebody in the group volunteers to do this, but they only give the beginning of the story. It could be something like, I got this text from my friend, and it sounded like he didn't want to hang out with me, but I didn't understand. And so then everybody else in the group sort of comes up with hypotheses and, different ideas about what could be the intention of that person. Where did that behavior come from? And then the person who actually had the real experience then describes the end of the story. And it can be, for some people, like kind of like a light bulb, like, wow, there are a lot of different possibilities for what people could what their intentions might be. And it's just incredibly helpful. You can imagine in your own life how this might work, where instead of immediately jumping to a certain conclusion about why somebody did something, if you can have more space to consider lots of different possibilities, you are helping your resilience and in terms of being able to maintain a sense of connection with that person, and to not necessarily immediately go down a rabbit hole of distress. So I hope that gave like a little taste of one exercise that we do, but there are lots of different ways to teach mentalization. And it's something I think the department actually is very interested in. We have some other experts in mentalization that we're working with here.
Thank you, Daphne. And that's terrific. Another great question. Have you considered offering this to juniors or seniors in high school who are thrust into the college situation without many tools? Many cannot visit the colleges, many are involved in sports, looking to be recruited, and the list goes on and on. So it's a great question I want to kind of answer, because one of the kind of bold visions that I've articulated when I became chief was really to expand our outreach and our impact on communities, on just leveraging. We're the second largest department in Mass General, over 600 people on faculty. We have incredible expertise that we just want to disseminate. So yes, I'd love to expand into high school, but let's start with colleges, because that's where a lot of the problems begin. Because you get your first episode of bipolar disorder in college. You get your first episode of depression, the first episode of psychosis. I would say let's focus on that, and then maybe with the trainer, we may be able to get disseminated to high schools. But I would say, you know, the biggest problems that we have right now is in the college age population. It's an absolute crisis. Daphne, what do you think of the idea?
Yeah, no, I agree. Obviously, the data is really supports what you're saying. You know, the CDC data that you know, this population is truly in crisis. We do have 2 programs for adolescents. I mean, adolescents, it's obviously really important to teach these skills as early as possible. But you know, there's some pluses and minuses to working with adolescents, because in some ways they haven't developed all the cognitive skills that you need to do some of this work. And it's really important with adolescents to involve the parents. And so we have a program where we also have some parent sessions, but obviously then that's, you know, it's harder to implement in that case. But yes, I think this the college population has an incredible amount of need, even before COVID-19. The amount of, I mean, working with you and the depression screening program, the amount of need that we saw every single time we did a screening was astounding, and it's so much more now.
Thank you, Daphne. Another great question. Are you considering creating a program for colleges that can be part of the freshman orientation program? Yes, I've always noted, parents send their kids to college, and they assume there's going to be seat belts with the, in the buses that transport them. That they have, fire hydrants, and they have all these things, for things that are extraordinarily unlikely to happen. And yet, the most common thing that can happen is, having a mental health issue. And what are we doing, in orientation to guide people? So what do you think, Daphne?
Yes, no, I wholeheartedly agree. That's what we would love to do. And in fact, our program is mostly made up of freshmen and sophomores, I should say. But yes, I think that ideally every freshman would enroll in a course like this. And that's part of our sort of my second goal and my goal slide is to develop a program where we, address, basically we have something for everyone.
The same person who suggested the high school said, in addition, we've had 2 adolescent suicides in our community this summer. But, I'll tell you, I get calls all the time from all over the country of desperate families who have lost their kid to suicide in college. It's heartbreaking. It's heartbreaking. I just, my heart goes out to all of them. But we should, we're developing, as Daphne mentioned, we're developing a vaccine for COVID-19. Can't we do something similar for these lethal psychiatric illnesses? So the next question, what types of mental illness do you think this prevention will work for? Would it even assist in those more severe illnesses that cause lofty economic issues in our society? Daphne?
Yes, well, as I mentioned, the idea behind this program is that it's transdiagnostic. And so we believe, and there's lots of evidence for this, that increasing resilience is preventative in terms of all mental illnesses, or, the major mental illnesses. And, there have been some studies looking at prevention of psychosis. And that's my original area of expertise, and so that's incredibly important to me that we make headway in that area. So there has been some evidence that these kinds of programs can either prevent the onset or make the illness less severe. But it still is kind of early days in terms of this kind of research. So again, there's so much more that needs to be done. But I think there's good evidence that that these are going to be effective programs.
And the trick here, is to call these a course or a program, because unfortunately, very myopic regulatory limitations prevent us from practicing out of state. So particularly psychological interventions, the board of registrations absolutely go after people who try to do that. Now, during COVID-19, they removed that for psychiatrists, but not for psychologists. And so it's very important. And if we want to help people outside of Massachusetts, we have to kind of frame it as a course or a program, because to reduce these obstacles that we encounter, which are completely nonsensical, in a global world where we should absolutely have much more freedom to help people outside of their own state. I think we have time for one more question. How can we begin to teach these skills to our college students now? Do you have a manual resource list? And a similar question, can you send contact information so that we can suggest this program to the colleges our students are attending or planning on attending? Fantastic questions. We'll provide you the contact information for Daphne, and absolutely, we want to make this extraordinary resource available. But again, remember, we do need philanthropic support. So, so anyway, at this point, we're at the end. So Daphne, sorry, we still have more questions, but I think they can email you.
Sure, yeah. I'd be happy, to continue the conversation. Yeah.
But I want to thank all of you. I mean, this has been an extraordinarily successful webinar. We've had terrific attendance, and I have to say, it was Donna's idea to put this together. So, I'm very happy with the attendance. We still have over 80 people online right now, so it's wonderful. I want to thank Daphne for a terrific presentation, all of you for participating. Please remain engaged with us, and I'm going to let Donna wrap it up. So thank you.
I want to thank Doctors Fava and Holt and all of you for joining us today. MGH will be emailing you a recording of today's presentation along with the contact information, as you'd asked about, for each of our speakers, should you want to learn more about how to support Dr. Holt's very important resiliency prevention work. We hope we will see you for our next resiliency webinar with Dr. Jean Berezin on November 17th at 4 p.m. Dr. Berezin's topic will be called Coping During a Pandemic, Tools for Promotion of Mental Health for Your Children and Grandchildren. Thank you so much. Have a great day.